We have with us today Mr. Frank Fiore. He is 64 years old. He's been a patient of mine for 4.5 years and began taking testosterone in February of '06, so that's almost 3 years. He had a extremely low free testosterone level. I'm going to move the decimal points just to make it clearer. The adequate range for this laboratory is 160 to 430, and he came in at 32. So he would have had to increase his free testosterone level 500% just to get into the adequate range. And if he had 1,200% more, he wouldn't have had too much. So what were you like before we started the testosterone shots?
I was down, had no energy, I was depressed, and now since I take this...
No, well, there was more you told me about. What about your sexual life?
Well, that was down too. Down.
How much sex were you having before you started the shots?
Really high, none, zero.
None. Sounds like you were pretty miserable.
Yeah, yes.
How long had you been that way before the testosterone shots?
10 years.
10 years. Okay, so then we discussed it. We did the blood test. We discussed it. You decided to try it, and I started giving you these testosterone shots. And what happened?
Well, after a period of time, maybe I felt the difference, like after maybe 2 months, 3 months.
Mm-hmm.
I had the energy, and my sex drive was better.
How often are you having sex now?
Well, once, twice a week, maybe 3 times a day.
3 times a day sometimes?
Sometimes.
Sometimes.
Right.
But at least 2 or 3 times a week?
Yes.
Okay. And you told me that you feel stronger, physically stronger?
Yes, yes, I feel more solid in my body, my muscles.
And what happened with the depression?
I don't have it anymore. Don't have it anymore.
Do you take any antidepressant medication?
No.
No. And you also said something about when you get up in the morning?
When I get up in the morning to go to work, I get up right away. No hanging around in bed. Just get up and get dressed and go.
Up and at 'em. Okay, so it made a big difference in your life.
Yes, it did.
Have you had any side effects?
No.
Nothing.
No.
So all good and no bad?
All good.
And you're a younger guy. And certainly looking at your face, nobody's going to think that you're 64.
No, a lot of people tell me, you know, they're amazed at when I tell them what they ask me what's my age, and I tell them the age, and they just don't believe. They think I'm 40 or 50, something like that.
Yeah. Well, I hope you tell them that it's because you're taking testosterone replacement.
Well, I talk to people, and where I work, you know, they're not really that intelligent. You know, they bus drivers, and what they know. You know
okay.
All right.
Thank you very much. I really appreciate it.
Anytime.
Okay.